Is in West Africa this morning, the first to head to that region since the Ebola outbreak began. We'll have more on that in a moment, but first, the growing criticism this morning over that mandatory 21-day quarantine imposed by New York, New Jersey, Illinois, and now Florida for healthcare workers who have been in West Africa helping Ebola victims. This is a New York doctor remains in the hospital being treated for the virus. Ron Allen is live outside of New York's Bellevue Hospital with more on all this for us. Ron, good morning.
Good morning to you, Lester. Yes, doctors say that Dr. Spencer is awake and communicating as his battle with Ebola enters what they're calling its next phase, which includes gastrointestinal symptoms. We also understand he's received a blood donation from another American aid worker, Nancy Wright-Bowl, who survived Ebola back in August. As officials here continue to stress, this potentially deadly disease threatens Dr. Spencer only, not the general public.
Overnight, Dr. Craig Spencer's fiancée, Morgan Dixon, returned to the apartment they share, where she will remain in quarantine as a precaution because of close contact with Spencer before he became contagious with Ebola. Dixon, who officials say has no symptoms, will have daily temperature checks and must remain at home in a building where neighbors say they are not worried about Ebola.
There's no running, there's no ruckus, there's no men in white suits, running up and down my halls.
Meanwhile, a new mandatory quarantine order for healthcare workers returning to the U.S. after treating Ebola patients is facing criticism from humanitarian groups, saying it's not necessary. A nurse, Kaci Hickox, now in isolation at a New Jersey hospital, despite a negative test for Ebola, wrote in a letter to a newspaper, "This is not a situation I would wish upon anyone," adding she was scared and made to feel like a criminal when she arrived in the U.S. from Sierra Leone.
In response, New Jersey's governor, one of 4 governors to order mandatory quarantine
because of the large number of travelers from West Africa arriving in their states, told the AP, "My heart goes out to her," adding, "My first and foremost obligation is to protect the public health and safety of the people of New Jersey." Meanwhile, as this freshly scrubbed restaurant and other places reopen after closing because Dr. Spencer had been there recently before testing positive for Ebola, most here are trying to keep all of this in perspective.
There's a real crisis in Africa, not really. A couple people doesn't really make it a crisis here just yet.
I'm hoping that with just one case, maybe they've isolated it. If there's more, then we'll think about what to do.
Medical experts continue to insist that they have isolated that one single case, Dr. Spencer. They also point out that at this point in the illness, early on, the condition of most Ebola patients tends to get worse before it gets better. So Dr. Spencer is expected to be here at the hospital for several weeks to come. Lester, Erica, back